We are back at Bullpen Pitch Fest. I'm James Zanowich, the Chief Strategy Officer from Tulane Medicine, and I'm here with Arti Prasad from Hennepin Healthcare. Welcome, Arti.
Thank you.
I would love to go through a few simple questions with you, if you don't mind.
Sure.
And the first one is to tell me a bit about your history and how you got to where you are right now.
Wonderful. I'm originally from India, and I came to United States in 1988. I was at University of New Mexico, and that's where I built my whole academic career. I learned from patients about health and well-being, because it's kind of interesting, right? The health really resides in the community. It doesn't reside within the four walls of a hospital. So I got very interested in integrative health and well-being, all the stuff that you just talked to Adam about, the diet and nutrition, the lifestyle, wellness. And I was able to develop a business plan and an educational program at University of New Mexico. I called it the Center for Life, which is my lifetime achievement, I believe. And I was able to connect with the media. I was able to connect with the state legislature. We're able to get funding from the state legislature as well as private philanthropy to open the center. I came to Minnesota as the chair of internal medicine of Hennepin Healthcare, which is the largest department at Hennepin Healthcare. And I was driven by the mission of Hennepin Healthcare and wanted to bring the change in a safety net hospital where health is infused in everything that we do, a holistic health, integrative health. So that's why I'm here.
I love that story. And so now that you're at Hennepin, what are you working on?
Yeah, great. So for the past, I've been working on a lot of things. I work on health equity. I work on primary care. I also work on, which is the passion, which is the integrative health. I've been working on upstream prevention of opioid crisis in the state of Minnesota. So everyone focuses on downstream, focusing on opioid use disorders, which is important, but nobody talks about prevention of opioid crisis, which is optimal pain management. So using non-pharmacological approaches to pain management, which includes diet, nutrition, mind-body work, other integrated modalities, chiropractic, acupuncture. And we have put Minnesota on the map. We are the first state in the country which has mapped out non-pharmacological resources for pain management throughout Minnesota through a website, nopainmn.org.
That is incredible. I love stories like that. And it's obvious that Hennepin Healthcare is really focused on helping others, which is very much the Bullpen's mantra. It's find someone, help them, repeat. But this is your turn to ask for help. What can the Bullpen community or the LinkedIn community watching this do to help you in your role?
Thank you. So when I gave my pitch, I specifically said, please come and talk to me, connect with me. I'm looking for partnerships, and not just partnerships. I cannot really quantify health. I want to change one health system at a time. So I am looking for, if you ask me to quantify, I'm looking to raise money between $30 to $50 million to create this infused health model. And this is going to be infused with love, compassion, respect, quality, high tech, but also high touch.
I like that. High tech and high touch is perfect.
Yes.
And so speaking of high touch, if people want to reach out and get in touch with you, how do they do it? What's your preferred method?
They can reach out to me in LinkedIn, which is profile is listed here at Bullpen. They can also email me. I have my electronic business card with a QR code, but I can say my email too of Hennepin Healthcare. It is arti.prasad, arti.prasad at HCMed. That stands for Hennepin Care Med.
Very simple.
.org. HCmed.org.
I like it. Great. Well, Arti, thank you so much for taking time to sit down with us today.
Of course.
You are the last one today. We're closing on a bang. I love it. And you're wearing your Tulane green, which is super important.
And I have to tell you, I'm also working on my culinary medicine certificate.
Are you?
Yeah, of course.
See, everything comes full circle.
Yes.
Well, I'm looking forward to grabbing a cocktail with you later.
Okay, great. Thank you.
Thanks.